Open Book with Susan Baier, the show where we get to know our local leaders and learn more about the people behind the titles. I'm your host, Susan Baier, the Executive Director of the Allen County Public Library. We're here in Studio B in Access Fort Wayne at our main library in beautiful downtown Fort Wayne. I'm so excited to chat with our guest today. Please help me welcome the Executive Director of SuperShot, Connie Heflin.
Hi there. Thank you so much for having me.
Thank you so much for being here.
Oh, this is such a great venue, so I really appreciate you focusing on SuperShot today.
Absolutely. Well, we'll get into it with what is the mission of SuperShot? What's SuperShot all about?
Yeah, SuperShot is a nonprofit based here in Fort Wayne, and our mission is to break down the barriers of access to immunizations. So we turn no one away for inability to pay, and we just want everybody in our community to have access to immunizations.
How long has it been in existence?
It started back in 1992, so two very strong women that cared about our local community. Dr. Jane Ermshire, she was the local health commissioner at the time, and Sister Mary Conrad Kershaw. She was a poor handmaid down at the St. Joe Hospital, and they came together and really were concerned about our low immunization rates, and they brought the CEOs of the healthcare systems in town together to address it. And it started off as SuperShot Saturday, and it was a completely volunteer-led project back in '92, and then it developed, it became its own nonprofit in 1993. So then SuperShot became its own nonprofit providing immunizations in the community starting back in 1993.
What's on the menu of the vaccinations offered at SuperShot?
Well, SuperShot, we serve children and adults. A lot of people don't think that we provide services to adults, but we sure do. But we're well known for children, but we provide all the CDC recommended immunizations for adults and children. So for children, children really have a lot of immunizations when they're first born. So it's RSV, that's a new vaccine that came out the last couple years to protect against respiratory syncytial virus. So RSV, all your typicals, Hep A, Hep B, MMR, measles, mumps, and rubella, chickenpox, meningitis, all of your standard immunizations that we get as children. And then we also provide all those respiratory season immunizations, flu and COVID and pneumonia and all of those. Same for adults. So we provide shingles, pneumonia, RSV, all of the same typical immunizations for adults too.
I know you have a beautiful facility on Hobson Road. Do you also take the vaccinations out on the road in the community?
Right. You're right. We've got that new clinic on Hobson Road, and we serve about 10,000 people every year through our clinics, our three main clinics. That's Hobson, our clinic up in Grable at Grable Missionary Church, and then we also partner with Fort Wayne Community Schools and Parkview Community Health down at Fort Wayne Community Schools Faith Center, so we're down there 5 days a week. And those are our three main clinics, but then beyond that, we traveled last year to over 250 community locations out in the community, and we see just as many people out of our clinic walls. We see 10,000 people out in the community as well. So we've come to the library before,
yes.
So thank you so much. You're a great partner. We provide seasonal flu clinics here at the library, and we go to places like Matthew 25 once a month. We go to Inasmuch. Lots of community partners, and then schools. We travel to over 100 schools in our community every year to provide immunizations.
You said you don't turn people away.
Yeah.
So how is payment handled? Do you work with insurance companies?
Yep, we sure do. We do all of the above. So we accept public insurance, so Medicaid. We accept commercial insurance, so what somebody would have through their work, their place of employment. And if you don't have insurance, no problem at all. We do ask for a small administration fee of $15 per vaccine that we do give. But if you can't pay that, that is okay. We want you to come and get your immunizations. We turn nobody away for inability to pay. No questions asked. We just really want you to be protected against those diseases that vaccines prevent, and you can come in and get your vaccines free of charge.
So how are you funded as an organization?
Yeah. So we are a nonprofit organization, and so our budget is a little bit over. It's right at $1.2 million, our annual budget. If you don't add in all of the in-kind value of the vaccines that we get through a federal program, but our budget is right at 1.2 million. And we fundraise. We're a nonprofit, and we really do depend on our community support. So we get about $700,000 a year through community donations, through foundation support, through individual support, through corporate donations. And then we earn revenue through when we're talking about insurance. Do we accept insurance? We earn revenue by billing insurance for those that do have insurance. So when somebody comes to us with a commercial insurance plan, it really does pay it forward for those who don't have insurance, because we can bill for those services and we're earning revenue to pay it forward.
So I have seen around town on posters and on social media something called the Healthy Hoosier Flu Challenge.
Yeah.
What is that about?
Well, that was something we launched this past year to really raise awareness about the importance of getting your annual flu vaccine and how important it is, and how our community flu immunization rate sits about right at 23%. So that means 23% of our community members get their annual flu shot. And the Healthy People 2030 goal is much higher than that. The goal is that everybody in all of the communities across the United States, 70% would get their annual flu shot. So we're trying to get closer to that Healthy People 2030 goal by this campaign that we launched last year. So it's really trying to create awareness, trying to encourage our community members to roll up their sleeves, get their flu shot, and for us to track it weekly to see, okay, yep, now, 10,000 community members got their flu shot. We got up to 103,000 community members got their annual flu shot last flu season, and we anticipate we want to do the campaign again. Now that we understand and we have data. Data was the biggest thing that we learned out of this first year, how to get the appropriate data and understand how many people are getting their flu shot. So now we understand the data process, so we know where we are and we can set that goal. We set our goal at 150,000, but that was based on data that wasn't exactly accurate. So our goal was very lofty. So we did give in Allen County about the same number of flu doses that we did the year prior, after we actually figured out the right data. And so this coming year, we can set our goals to be a little bit more attainable and realistic.
Is there an ideal time of year to get your flu shot?
Yeah, you want to get it before the end of October.
Okay.
So that's when you ideally want to get your annual flu shot. Flu shots, the new version is typically available starting in August every year. The CDC studies it, and the manufacturers of the vaccines, they tweak the version every year to really address the different strains that are circulating. And so we'll have that new variation starting, in August. But really, the goal is to get it by the end of October, your flu shot. And then you're protected for the holidays. It takes about 2 weeks for your body to build up your own antibodies and be completely protected and, be healthy for the holidays. Yeah.
So get that flu shot before you go trick-or-treating.
Exactly. That's a perfect way to remember it. Yeah.
How serious can the flu be?
Right? Flu is serious. A lot of people say, I don't need the flu shot. I don't get the flu. It's not serious. It's not serious until it is. I mean, it's not, we had more pediatric children deaths this year due to flu than we've seen in decades. And so the flu just hits younger kids and older people harder than the rest, but it can hit anybody, regardless of your age, and you can have a bad response. So the goal with the flu shot, it's not going to prevent you from possibly getting it. It's going to keep you out of the hospital. So it's same with COVID vaccines. Really, unfortunately, we can't completely prevent you getting those different viruses, but it can definitely decrease the instance of a severe outcome and landing in the hospital and, heaven forbid, dying from a disease like flu.
So there's a lot of conversation locally on a national level about vaccines.
Yeah.
And people have questions.
Yep.
Parents particularly have questions about what's the right choice for their children.
Yeah.
Where would you recommend they go for that information?
Well, I would say start with your doctor, start with your healthcare provider, and they want to have those conversations with you. They want you to feel like your questions have been answered and that you feel confident in the decisions that you're making for your healthcare. So I would start with your pediatrician, a parent talking to their pediatrician. You can also you could call SuperShot. We have nurses. All they do all day long is provide information and administer vaccines. So that's our lane, that's our area of expertise. Or go to a trusted website like the CDC website. It really is a trusted, vetted website with accurate data. So you just really want to trust your data. You don't want to make your healthcare decisions based on what you saw on a TikTok video or, on social media.
So let's talk about needles.
Yeah.
Because, it's part of it, right?
It is.
It's not fun.
Right.
How does SuperShot make it easier, particularly if you have patients who have some sensory needs?
Yeah. Well, right. Needles are not fun. Who wants to go get a poke? But we have tried, and with the new building that you referenced, our new clinic on Hobson, we have a sensory room, and we're so excited. Like we said, we are funded by donors, and donors made it possible. So we have an extra large exam room that has all kinds of accommodations. So it has a bubble wall where you can look at the sounds and just hear the bubbles, so it takes your mind off of, your fear of what might be coming, getting that immunization. We have sound canceling headphones, we have sunglasses, we have fidget toys, we have all kinds of things that kids can play with on the walls. We also partner with the Indiana Autism Society that provides a whole kit that a child can use during the visit to help accommodate those and lessen those fears, but they can take the kit home. So we really try to understand too, what are the triggers? We work with the parents or the family member that's bringing somebody in and understand everybody's different. Everything, just being in a room can trigger some people, or a smell, or lights, or how we're going to talk about it, even how we're going to approach the situation. So we really try to understand from a family member what works, how has it gone before when somebody's got an has received a shot, and are there any tricks that works with a certain person? And we always want to give lots of time too. We don't want to rush it. We want everybody with sensory issues to feel welcome, heard, and accommodated as SuperShot. So we do that through our sensory room and a lot of staff training.
Are any of those tricks available for, say, for instance, a library director in her 50s?
Absolutely. Yeah. We have all the accommodations you need. And if you have a special accommodation, you let me know, and we will make sure it's available.
Okay, I'm holding you to that.
Okay.
Holding you to that.
Absolutely.
There have been a lot of news reports this year about the measles.
Yeah.
What can you tell us about what that looks like in Allen County?
Right. So measles. We have an outbreak. We have over 1,000 cases in the United States. I think as of last Friday, we have over 1,020 cases. And the outbreak is specifically down in Texas, but it's spread to 14 other states and Indiana. We've had our first cases here, and in Indiana, in Allen County. So we've had we had 8 cases. It was contained to 8 cases. And those are the first cases in Allen County since 2015. So, that our immunization rate, it's for measles, it's the MMR vaccine that stands for measles, mumps, and rubella. The immunization rate in Allen County is it's right under 82%. And we really need our local immunization rates to be much higher for that, because measles is very contagious. And the goal is what's called, to get to herd immunity, is 95% of community members would get their measles, mumps, and rubella vaccine. because that really stops the spread. So we have a lot of people that are, and so measles, the measles vaccine, you get your first dose at age 1. So when a baby turns 12 months old, and then they get their second dose typically at age 4. So babies can't get it until they turn 1. And so we're trying to protect those babies that aren't old enough yet to get their measles vaccine from it through what we call herd immunity.
Have you had questions from adults who may not have access to their immunization records, or it's been a long time and they're just not quite sure if they need a booster for the measles?
Right. We've had a lot of questions from adults, right? Because, nobody wants to get measles. So measles vaccine, if you were born before 1957, you're considered to have natural immunity. That it was so prevalent in our communities, measles. When I say measles was so highly transmitting before 1957 that if we were born in 1957 or earlier, it is assumed that we have natural immunity, that we got it naturally, and you've recovered, and you went on with things. If you got your immunization between 1957 and 1968, there was a measles vaccine that proved not to have long protection against measles. And so if you were born between that window of time, it is recommended that you get a booster shot. If you were born after 1968, you and your parents got you vaccinated, you shouldn't need another measles vaccine. You are considered to have lifelong protection through those immunizations that you got when you were young. Yeah.
You mentioned herd immunity.
Yeah.
What exactly does that mean?
So herd immunity, it's like your superpower, a community superpower. So herd immunity is when enough people get a vaccine so they don't get the virus or the disease that we're trying to stop, and it protects those that don't get that haven't had the vaccine. So consider this is the person who isn't vaccinated, and all these people are vaccinated, and you wrap that around it, and the virus can't get through the barrier of that vaccine wall. So herd immunity is when a community comes together to protect those that can't get the vaccine because they're too young, like we talked about with measles, that a child doesn't get it up to the age 1, or it's somebody going through chemotherapy and their immune system is really compromised, and they are they are more prone to get a disease. So when we keep diseases at bay through all of us standing together and creating this wall of defense through getting immunized, we protect those within our community from getting those diseases because we're not spreading the disease. So I don't know if that answers it, but for me, it's like this super shield of trying to protect those who can't. We're all coming around them, and that's why I think immunizations are so important. Obviously, they protect each of us from getting something, but it's something you do for the whole community. It's something you do for your community member, that stranger at the grocery store. You're not spreading disease, and you're keeping everybody else healthy.
How are our vaccination rates here in Allen County and Indiana? How do they compare with the rest of the country?
Yeah, we're right kind of in the middle of the road. We're not at the top, we're not at the bottom. Indiana's immunization rate sits right at 62%, and this is all based on infant immunization rates. So there's different immunization rates for flu, like I said, only, less than 25% of our community is getting their flu vaccine. But when the CDC says, what's your immunization rate, they're normally talking about the rate that infants complete their series of vaccines. So it's an infant rate from 0 to 35 months, and there's a whole series of vaccines that infants are supposed to get during that window of time. And in Allen County, 60% of our children are completing that series. So that's not real great. I mean, that leaves 40% of our kids unprotected from disease. The state rate for that same completion rate is 62%. And the country, it averages out there, but Massachusetts has the highest immunization rate, and it sits closer to 80%. So we're in the middle of the pack, which we could do better.
So I moved to Allen County in February of 21.
Yeah.
And we were just a few weeks away from the COVID vaccine being readily available. What were those months like for you and SuperShot as that vaccine was first coming to Allen County? What was your role in getting that distributed to people?
Right. I mean, I can remember those days like they were, I mean, it's kind of, it's like it was a long time ago, but it was yesterday, all at the same time. And so everything kind of switched for SuperShot in March of 2020. We used to be a walk-in clinic and you couldn't make appointments. We were just walk-in services only. Well, you couldn't let 20 people walk in at once and come into our clinic because we needed social distancing and so on. So our process changed instantly. We didn't miss a day. SuperShot stayed open every single day through COVID. We didn't miss a day. And we were the only point of access for your routine immunizations. We didn't, obviously, in March of 2020, the vaccine wasn't out yet, but the county was responding to, okay, what next? What are the protocols our community needs to take? And responding to all the contact tracing that was going on. We were the only location that was providing routine immunizations at that point. A lot of the physician offices, they didn't have the personal protective equipment yet. They didn't have the mask that they needed so they could see patients in person. So we stayed open, we changed our processes, and we continued to provide immunizations. When the vaccines became available, then in December of 20, our staff actually helped up at the Merrill Center. The Parkview Merrill Center was our community's major hub for providing COVID immunizations. And I can remember that like it was yesterday. There were 10 vaccinators, 5 tables with 2 vaccinators on each side, and any given day, over half of those vaccinators could have been a SuperShot vaccinator up there working. So we help by providing staffing and responding to that need, and then keeping our clinic open too for those routine immunizations. And then when the COVID vaccine became available for 12 years for children, that's when we as a community really worked together to make sure that we were providing kids access to the COVID vaccine in a place that didn't feel quite as scary as a big auditorium or coliseum. So that's when we partnered with Parkview and the health department, and we pointed all the children to SuperShot. And we were seeing, it was, the fast pass where we had lines of people. We were seeing over 100 patients an hour providing COVID. Yeah, it was crazy busy there. And then, we worked through that, and it built a lot of good relationships in the community too. We learned a lot, and it made us change a lot of processes. But and it was it was something you'd never want to go through. But we built a lot of strong relationships and trusted partners through the process.
Connie, what drew you to this role? Have you always been in a healthcare related field?
No, I haven't. And I don't pretend. I'm not a doctor, and I don't even pretend to be one on TV. Right? I have been working in the nonprofit sector for most of my adult life, and I've always been on the fundraising end for nonprofits. And going back to 2017, SuperShot's executive director, who'd been with the agency for almost 18 years, she was retiring, and there was a search group, and St. Joe Community Health Foundation, the director over there said, Connie, I think you should think about this. And I said, well, and SuperShot at that point really needed help with fundraising. And but the more I learned about the agency and the ability to build something and to come together in the good of the community was something that's very appealing to me. Like I said, vaccines, it might not sound so glamorous, but to me, it's something that we can all do to help each other stay healthy. And if we don't have anything, if we don't have our health. Health is something, I guess, my own personal journey. I had our oldest son. He's doing really well now, but he really had some health issues when he was younger, and that just really made it real to me that if you don't have your health, if nothing else matters. And so keeping our community healthy, providing a service that our community needs, and doing it well is something that really appeals to me. Yeah.
My family always told me growing up, health is wealth. And I didn't get it as a kid, but
Yeah.
I certainly get it now.
Right?
Yeah.
I mean, because it's something you take for granted until you don't have it. And so vaccines are so effective. I know that, like you said, they've been in the press. They get a bad rap sometimes going down this political, path we've been going down, but they really are one of the most cost-effective and easiest ways to protect your health.
This is a question I love to ask all my guests because I get such interesting answers. What was your first job, and are there any lessons from that job that carry over to this day?
Oh, boy. Oh, well, okay. I grew up in a farm in Iowa. So my very first job, my dad's a farm, like I said, he was a grain farmer, and he believed in hard work. And we sold sweet corn. So he was a grain farmer, but he was a big gardener, and he planted sweet corn. And my brother and I, my mom and dad would help pick it. We would carry these buckets, and we would sell sweet corn. And we didn't get allowance, but we got the money that we earned selling sweet corn. And we had to learn how to make it spread the whole year out. And so that was a very big lesson for me. Budgeting, because I was like, oh my gosh, let's go to the store. I want to go buy some new clothes. And my brother was very much, he was saving every penny, and he'd always come out ahead. So, and my parents were like, well, you had your money, it was trying that lesson. So it was and it was getting up early. And that was my very first job, was selling sweet corn, and learning those customer service skills, learning how to get up and do something maybe you don't really want to go do, because it was itchy and wet in the cornfield.
Oh, yeah.
It wasn't, and then, but it was talking, and we would get repeat customers year after year, and they would place orders in advance. And, hindsight, maybe I have great memories of it now. But when I was little, I was like, oh, it was selling sweet corn. So, but that was my first job, and it definitely had an impact on just how I approach things in life.
Our very last question is a segment that we like to call here on Open Book, the tail end with Toonces.
Okay.
And I will explain. Toonces is my very opinionated gray rescue cat.
Oh.
And he couldn't come to the studio today, but he had a question for you.
Okay.
So, just FYI, Toonces gets his vaccinations every year.
Good.
He growls a bit, but he gets it done.
Okay.
And he wanted me to ask you, how brave are you when getting vaccinations?
I am not that brave, but I do it. I do it anyway. And I have, I'm surrounded by a lot of clinical staff who will say, Connie, today's the day. We're going to get it done.
Put on your big girl pants. Let's do it.
And let's do it. And so just like if I don't look, I look the other way, and it's over in an instant. And I drink a lot of water, move my arm, and I'm good to go. But I am not the first one who's in line to get my shot. I will admit that, but I do get it done every year.
Same. And I do this thing, I squeak. I've actually talked to your staff about this. It's just involuntary, but I just automatically squeak when the needle goes in.
Well, that's okay. A squeak that's great. It's better than, anything goes at our office. We're just glad you're getting your shot.
You probably see quite a bit of reactions.
We
yes,
do.
On the gamut. Yeah.
Exactly. We see it all. We see, the great, big, strong high school boys who faint like in an instant. That's really not nobody wants that, but we see the whole gamut. So a squeak is good. I'll try a squeak. I normally am pretty quiet, and I just look the other way.
I squeak, my cat growls, so there you
go. Well, I wish he could have been here today, and I'm glad that you keep him up to date on his immunizations.
Definitely.
Yeah.
Connie, thanks so much for coming in today.
Oh, thank you so much for having me. I really appreciate it, and I appreciate your partnership. You yourself are a huge advocate for immunizations, and we didn't talk about it, but you have really opened up the door and the access here at the library from your experience at the library systems that you had been at previously. So I thank you for being such a huge champion of immunizations and the health of our community.
I'm just so an admirer of your work and your staff's work, and I think it's a natural collaboration. Happy to do it.
Oh, thank you, Susan.
And thank you for watching Open Book with Susan Baier. Until next time, keep turning those pages.
Production facilities provided by Access Fort Wayne. Learn more under the Services tab at acpl.info.